Our next guest we're privileged to have on the show is Dr. Karen Randall. She is an ER physician from Colorado, and she's seen the experience in Colorado from before it was legal, from when they decriminalized it, when they had medical marijuana, commercialized medical marijuana, and went all the way to legalized, and she's experienced that in Pueblo, Colorado. And so she's going to be able to give us an in-depth look at what she's seen in terms of the costs on the healthcare side of legalized marijuana in her city. So welcome, Dr. Randall.
Oh, thank you. I'm here, and thank you for the opportunity to speak. I'd like to just talk about our costs that we're seeing in Southern Colorado. I work in the third busiest emergency department in the state, and over the last several years, we've noticed a definitive trend, which hasn't been good, and it's actually alarming. First, I'd like to start by saying I have a disclaimer. I don't make any money by speaking about the marijuana industry or speaking out. When people are talking about the industry and the benefits, you have to ask yourself, are they making money and will they profit from speaking or saying stuff about the industry? I don't make any money and I don't have any financial investments. I'd like to start by saying that we're dispelling a few of the myths. All of the products, the cannabidiol oil, THC, and hemp products, they all come from cannabis sativa. The scientific name is cannabis sativa. There are some variations, but they all come from cannabis sativa. So CBD and THC products are cannabis. There are numerous companies now currently in Colorado, and actually I've seen a lot from across the country that are advertising CBD, and they're advertising that CBD is harmless and has a number of curative powers. Most of the curative powers that are being advertised are actually not founded, and I'm seeing advertisements as far as curing eczema to curing cancer. We know, and we're seeing increased medication interactions with CBD products. We know that probably we'll see more as time goes on. And one of the biggest complications that we're seeing is an interaction with CBD and Coumadin or blood thinning products, because it will extend it and cause or lead to problems with bleeding. When we look at THC, again, echoing what Dave Evans said, the industry has been really irresponsible in creating THC products. Instead of being what we typically think of the Woodstock pod of 1 to 3 milligrams, now we have THC concentrates that can reach up to 90% THC, some even higher. People are consuming these by smoking or vaping. When they're doing a dab, THC concentrates are made with harsh chemicals such as butane, propane, etc., that are known to have human side effects without doubt. Also, the THC or the hemp cannabis plant is a pretty good soil scrubber, so it will pick up toxic metals, heavy metals, soil contaminants from soil. And what happens when these contaminants get incorporated to the plant and we concentrate them, we actually concentrate heavy metals and contaminants into the end products, which would be the THC or dabs. Again, an average joint now currently in Colorado is 18 to 22 milligrams of THC. If we do look and compare that to the Woodstock joint, which was 1 to 3 milligrams, we know that today's joint is an average of 9 Woodstock joints. And when we increase the potency, increase the power, we're not reducing harms. There are incredible number of products being made by the companies. You can get anything from THC-infused tampons, THC inhalers, patches, pills, creams, and edibles. And many of these products are designed and meant to deceive. People in Colorado, many of them admit to consuming over now 2,000 to 5,000 milligrams of THC a day, which is a very large amount. Along with a marked increase in usage, we're now seeing a host of medical problems. These problems, as Dave Evans said, include lung problems, psychosis, altered mental states, pediatric ingestions, hyperemesis related to cannabinoids. Additionally, we're going to see long-term problems in children who are children of parents who used cannabis while they were before the kid was delivered. When we look at specific medical issues, we're seeing an increased number of ER visits for problems related to the use of THC and cannabinoids. Perhaps the most disturbing that we see is acute psychosis. And there is no question when we look at today's research that the younger you use and the more you use, the more risk you are for psychosis. We don't know why, but there seems to be an association with schizophrenia, and that pattern is not fully understood, but it seems to precipitate schizophrenia in some people. This psychosis that presents is actually quite frightening. When THC is used in combination with methamphetamines, these people are perhaps some of the most acutely psychotic people that I have seen, and actually are pretty scary, requiring a lot of police attention and are destructive to a community. The medical costs are definitely mounting here in Pueblo, Colorado. We most likely cannot calculate the true cost to the community as a whole. For instance, we have a young person who was exposed to a butane oil explosion. It resulted in greater than 30% second and third degree burns. They were flown from here to the burn center. They required prolonged hospitalization, multiple skin grafts, and they have marked disabilities. So this will lead to a lifetime of disability in this individual. And the cost of that care is really not calculable. How do you cost of medical care alone at the burn center, I'm sure would exceed $1 million, but then add a lifelong disability as well as that. If you look at another cost, a young man who was high on THC had a shootout with police and had multiple GSWs leading to high paralysis, so he's a quadriplegic. His care will be lifelong, and again, his costs are incalculable. Looking at some realistic costs on a daily basis, we see hyperemesis related to cannabinoids. Approximately 10 years ago, this was a case report. It was so rare, but now we're seeing this on at least a daily basis in our community. And these are people who use cannabinoids pretty frequently and are heavy users. We don't know why certain people do have this reaction, but when they do, it's pretty profound. These people often have frequent emergency department visits that lead to sometimes even hospitalization and even renal failure and ICU care. If we look at a typical cost, when we see a patient who comes in with hyperemesis, and I would guess that our emergency department sees at least one patient a day and most likely more than that. It's also termed scromiting because it's a combination of scream vomiting, and the presentations are usually pretty profound. But if we look at the cost of a single ER visit for a person who presents to scromiting, the facility fee, what we charge, is $2,600. The CT cost, because a lot of them get evaluation for abdominal pathology with a CAT scan, is about $3,400. The physician fee is $350. This is a total estimate cost of $6,300. But please be aware that these costs that we're talking about are certainly not what the hospital is being reimbursed. But if you look at an estimated cost of $6,400 and you times that by one a day, that's an annual cost of $2.3 million just for one single diagnosis in one ER. And we have multiple ERs across the state who are looking at the same problem. And this
is great, Dr. Randall. What you're saying is that before 2014, this is a case report. So
probably before 2010.
Before the commercialization of medical marijuana.
Correct. This was so rare that it was a case report, and now we're seeing it daily. And we probably see, I know we see at least one case a day, and we probably see more because a lot of times they're coded out as nausea and vomiting and not really hyperemesis.
And you're thinking this is tens of thousands of dollars, if not, as you said, more if they go through the full CT workup.
Right, and we're just talking about facility fee, CT fee, and physician fee. We aren't talking about the cost of medications. We aren't talking about costs of not being on the job or not being employable. We aren't talking about like the multiple visits that these people have, and this doesn't even touch the cost of hospitalization should they require that. So this is just one small part of a cost that could be incurred by someone with hyperemesis.
Is this a frustration for ER physicians? Does it make it difficult for you to maintain your morale, to recruit new ER doctors into your hospital and whatnot? Is this a, are you spending more money trying to recruit personnel?
This has actually been a real big problem with our area, and it's never been a rich area. And it's always been just on even keel. And of late, we're having a very difficult time recruiting providers. Unfortunately, we've seen a lot of drug-related complications and drug-related ER visits, which unfortunately, when someone comes with squamine or the hyperemesis, their presentation is so profound that they get brought back. And they get brought back in preference or deference to the older lady who's sitting with a GI bleed in the waiting room, whose wait time now is 5 to 6 hours. So we've seen more difficulty in getting providers. Our ER wait times have gone up, and we've had a number of community issues that I'll talk about in a little bit. Let's go to slide 12. Now, if we add on like additional costs, I have a story where we saw a young teen using cannabis. He had a psychotic break in an outside state while he was on spring break. That break was so profound that his parents went and brought him back to the state. He was seen in our hospital system. He was hospitalized in our offsite adolescent unit. And at that point, he had another psychotic break. He assaulted 3 healthcare workers. So we're talking about additional costs to the injury to the healthcare workers. Due to the fact that the community is really short on resources, we don't have enough psychiatric beds, we don't have enough rehab, and especially for adolescents, this is a statewide problem. He was released in a couple of weeks. Subsequent to his release, he attacked another person, and that person was so injured that they required ICU care. So those costs are not calculable. And that patient was ultimately sent to jail, and the only thing he ever tested positive for was THC. And this is just one case. So he's had a prolonged adolescent stay. He had multiple ER visits, and he also caused other people to have ER visits. And now, most likely, he won't be productive because he'll be in an institution, either a jail or a psychiatric facility. And so what's the cost of the lost wages for this kid, and what's the cost for one lost person in society? It's pretty hard to calculate all those costs. Let's go to slide 13. If we look at opioid deaths, there's a lot of publication in the media these days saying that marijuana is a great alternative for opioids. The case is not being shown to be true here in Colorado. This is a graph of opioid deaths over time. If you can see towards the end of the graph on the right side, the years 16 and 17, the opioid deaths are skyrocketing. We have a community that has very liberalized THC and marijuana products, and yet our opioid deaths continue to rise. It is, again, as Dave Evans pointed out, it is the #1 drug associated with adolescent completed suicides. It is the #1 diagnosis in adolescent treatment centers is cannabis dependence. And so those costs are, again, mounting here in Colorado. Go to slide 15. Let's talk about some of the community effects that have happened over the last 5 years. Our community in Pueblo is about 110,000 people, and the community in the county is 160,000. In our community of roughly 160,000 people, we have a total of 49 retail cannabis or medical dispensaries. In addition to that, we have over 100 grow sites. So these are legal grow sites. If we look at that per person, that's quite a bit. And the reality is that our community isn't really benefiting. If we look at what we're seeing now, we have a significant problem in our schools with chronic absenteeism. Last year, our chronic absenteeism rate was 27 to 29% in Pueblo District 60, and this year it's 38%. That's over a third of our kids are chronically absent from school. Our school teachers had to strike to get a 2% pay raise. We have no homeless shelter. We actually may have a homeless shelter that's temporary that opened yesterday, but basically we have no long-term homeless shelter. And we also have a huge number of homeless here that we've never seen before. There's been several articles that try to calculate the cost of a homeless person to a community, and roughly the estimate is about $44,000 per year per homeless person when you consider legal costs, police costs, hospital costs, damage to the community costs. It's roughly about 44,000. So even if you increase the community homeless population by 100, you're talking about a significant cost deficit to the community. If we look at Pueblo in specifics, of 110,000 people in Pueblo, about 69,000 of those are on Medicaid. So you can see if this is a huge Medicaid population, it's very hard to get providers to come when the sole population or the good majority of the population is on Medicaid. So we've been losing providers at a rapid rate, and it's been very difficult to recruit people to come in unless they're hospital-based employees. And again, this puts a strain on the hospital. Let's go to slide 16. Let's go back to 15. What we have here in Pueblo is that we've had two hospitals. One of the hospitals that have been here for 132 years had significant financial issues and is now undergoing an overhaul and is basically closed down for all except a few essentials, which has put a tremendous burden on the remaining hospital. And even though we try to staff up, it is very difficult to staff up for the number of drug-related issues that we're seeing. I have done a long-term study looking at all the urine drug screens done in our ER. They're basically done for three reasons: trauma, altered mental status, or psychiatric complaints. And in general, since 2013, not only was it increased in, as we expected, in cannabis use, but all drug usage increased. And in the last 6 months of this year, methamphetamine use along with THC has tripled. So it isn't counteracting any drugs, it is actually increasing drug usage in our community, which leads to increasing hospital resources being dedicated to the people who become severely ill from their drug addiction, and leads to us having difficulty providing actual care and ongoing care to the people of the community who are not using drugs. And then we'll go to the last slide. And so personally, this is what cannabis and legalization of marijuana has meant to me. The community, the industry said that we would have, we'd be able to control illegal grows. There have never, ever been so many illegal grows in Colorado. If you just Google illegal grows in Colorado, it will fill pages of a Google reply. What it personally means is there's the picture on the left is a SWAT team leaving my neighbor's house. I spent 18 years teaching in a large hospital in Detroit, and I never saw a SWAT team coming from my neighbors. This is a known Cuban cartel grow house. It's been busted twice. This was the last time in August. This is a picture I took. The picture in the upper right-hand corner is my brother who lives 90 miles away. The house in the background that's fully involved in fire was also an illegal grow house in his neighborhood. And that's 90 miles away. I had another partner who lived in Parker, Colorado, and her neighbor was an illegal grow. My scribe who lives in Pueblo, her neighbor grows illegally. So you see the likelihood of the four of us having somebody who's an illegal grow next to us it's so prevalent that you see this all the time. Finally, the bottom picture on the right-hand side is a remnant of a homeless camp. We have many homeless camps here in Pueblo. The homeless camps in and of themselves are providing a very difficult and challenging time because we know that there are community problems related simply to the homeless camps. There's been a number of fires. The people are living by our Arkansas River. The E. coli count from the river has never been higher, so we're dealing with those kind of issues as well in the community. So overall, even if we just take a few of the problems that we're seeing related to cannabis and related to expansion of drugs in the community, it's totally overwhelming financially. The community or the industry, the marijuana industry, when we look at gross domestic product for the state of Colorado, is only 0.42% of our GDP. So you can see that totally doesn't add a lot of benefit to this state. When we talk about the cost of the state, it's just almost incalculable.
Okay, well, that was quite a lot of information. Thank you very much, Dr. Randall, for sharing your experience with us. We see that all the promises haven't all come true, and unfortunately, it looks like your community has paid a high price for the commercialization of marijuana in just that little area.